Hello, my name is Dr. Patricia Dawson. I'm a breast surgeon at the Swedish Cherry Hill Comprehensive Breast Center and the Swedish Cancer Institute Breast Program Leader. I've been asked to speak with you today about breast cancer surgery and recovery. First of all, you should know that there are several different types of breast cancers, so you cannot compare your situation with someone else's. Therefore, this podcast is intended to provide a general overview of breast cancer surgery, what to expect in the hospital, and some helpful hints for you when you are home from the hospital. To start, most patients with breast cancer will have surgery as the initial step in their treatment plan. For some, it may be the only treatment necessary. For others, it may be combined with radiation therapy, chemotherapy, and/or hormone therapy. Now let's talk more in depth about two common types of breast cancer surgery: a lumpectomy, or partial mastectomy, and a total mastectomy. The terms lumpectomy and partial mastectomy are used interchangeably. A partial mastectomy is when only part of the breast is removed. The goal of a partial mastectomy is to remove the part of the breast that contains the cancer, and also to get clear margins. Clear margins are considered the cancer-free tissue that immediately surrounds the actual breast cancer. Another goal the surgeon has while performing a lumpectomy is to try and make the breast look as close to normal as possible. After recovering from a partial mastectomy, the patient will usually receive radiation therapy to the breast to decrease the chances of the breast cancer returning. The second type of breast cancer surgery we're going to discuss is a total mastectomy. A total mastectomy involves removing the entire breast. This includes removing the breast tissue, some of the overlying skin, and usually the nipple and areolar complex. Some women after a total mastectomy will desire to have breast reconstruction by a plastic surgeon, so it is good to know that most women will have reconstruction as an option. Breast reconstruction can be either started at the time of the mastectomy or done at a later time, after all the other treatment is completed. The timing of reconstruction will be influenced by other necessary treatments and your overall health status. Most women who have a total mastectomy will not need any radiation therapy. The terms that are sometimes used for breast operations can be confusing. Simple mastectomy and total mastectomy usually mean the same thing. A modified radical mastectomy is a total mastectomy plus the removal of lymph nodes in the armpit area. This is also referred to as a total mastectomy with an axillary lymph node dissection. A radical mastectomy involves removing the breast and lymph nodes, as well as the muscles of the chest wall. Radical mastectomies are very uncommon these days. Now that you understand the procedures, let's discuss the 5 factors we need to consider when making the decision between a partial mastectomy and a total mastectomy. Number 1, we consider the size of the tumor compared to the size of your breast. If the tumor takes up a large portion of your breast, or if there is tumor in more than one spot in the breast, total mastectomy may be recommended. Number 2, we then must identify the location of the tumor within your breast. If the tumor is directly under the nipple, it may be impossible to do a lumpectomy without removing the nipple. That has a significant impact on how the breast will look at the completion of treatment. Number 3, we have to classify the type of cancer that is in your breast. Tumors can grow in different ways, so with some cancers it may be more difficult to get clear margins, or the cancer-free tissue around the tumor like we discussed before, with a lumpectomy. Also, some women may have tumors in multiple locations in the breast, making lumpectomy not possible. Number 4, we study the imaging findings. The information obtained from mammograms, ultrasounds, and possibly breast MRIs may help to determine the best type of surgery for your particular circumstances. Number 5, the final factor we consider when determining your type of breast cancer surgery is your overall medical health and your personal wishes. Frequently, the surgery will also involve removing some of the armpit lymph nodes for evaluation. That is done either using a procedure called a sentinel lymph node biopsy to see if any lymph nodes contain cancer, or a procedure called an axillary lymph node dissection to remove cancer-containing armpit lymph nodes. The difference between the two operations lies in how many lymph nodes are removed and whether or not the lymph nodes are known to contain cancer before surgery. Before we move on, it is good to know that some women may not have surgery as the first part of their treatment. For selected patients, chemotherapy may be used first to shrink the tumor so surgery can be made possible. This may be the course of treatment if the cancer is large, stuck to the skin or chest wall, or in several armpit lymph nodes as well as the breast. Another reason why surgery might not be used is if a woman has cancer that has spread to other parts of her body. If this is the case, surgery may not be beneficial, since the most important part of her treatment may be with chemotherapy or hormone therapy. Now that we have covered the types of breast cancer surgery, let's go over a few of the risks associated with surgery. There's a small risk of infection with any surgery. Also, there may be some bruising and collection of fluid within the breast tissue. Most patients have soreness after surgery, but usually not severe pain. Many women find that they need the stronger pain medications for a day or two after surgery, and then they can switch to Tylenol or ibuprofen. Ice packs may also help if there is aching. If you have had a total mastectomy with or without reconstruction, your doctor will let you know if it is okay to use ice packs. Finally, there may be some arm stiffness that can be relieved with gentle stretching. Now let's move on to talk about what to expect in the hospital during your surgery. Most breast cancer surgery can be done as a day surgery procedure. The exception to this may be women who are having total mastectomies, who are usually asked to stay in the hospital overnight. The length of the surgery can vary, but usually will take from 1 to 3 hours, depending on the procedure. The surgery can take longer than 1 to 3 hours if the patient decides on immediate reconstruction, which can add an additional 1 to 2 hours to the operation. Women with immediate reconstruction may also be able to go home the day after surgery, or may need an additional night in the hospital. Most women will do better at home and will lower their risk of infection by not staying in the hospital longer than necessary. Once the surgery is completed and you are home from the hospital, you can expect a variety of different feelings. Most women will feel better if they are up and moving around quickly after surgery. It is also normal to tire out easily, which may lead you to needing more rest than usual during the day. Your tiredness may last 2 to 4 weeks or sometimes longer. Walking or going up or down stairs and non-strenuous activities are fine, as long as you remember to pace yourself and rest when you get tired. Your surgeon may ask you not to lift heavy objects for a few weeks after surgery. After surgery, it may take you a few days or weeks to get back to your normal range of arm motion. Once you've gained back close to normal range of motion and do not need narcotic pain medications, then generally it is okay to drive. Again, if you've had immediate reconstruction, please discuss activity and limitations with your plastic surgeon. One other tip to remember when having breast cancer surgery is to get your support system lined up before you go in for your operation. This is important because there's a good chance you might be feeling more tired than normal for several weeks. Also, you may want to think about stocking up on groceries or pre-prepared meals. In addition, you may want to arrange for rides to appointments or other outings for a week or two after surgery. Most women will not need special nursing or home care after surgery, but they will benefit from supportive family and friends. Some women may have drainage tubes that will need to be emptied regularly. For more information on drain management, please listen to the Drain Management podcast in the breast cancer series. Generally, most breast cancer patients can shower the day after surgery. Again, the exception would be women who have immediate breast reconstruction, as the plastic surgeon may want them to wait before getting the surgical area wet. During the many weeks after surgery, your wound will continue to heal and change. You should know it is normal to develop a ridge or area of thickening under or around your incision. The incision will continue to change for several months, and the thickening will gradually become less noticeable. You do not need to apply any special creams on your scar because it will heal nicely on its own. The physical recovery for women after breast surgery usually happens quite quickly, but the psychological and emotional adjustments after your surgery may be more challenging. Some women, particularly women who have had a total mastectomy, may be reluctant to look at their incisions and may feel self-conscious. If you find this to be true for you or a loved one, speak with your Swedish treatment team for help with these feelings and adjustments. Finally, once you have recovered from the surgery, the other parts of your cancer treatment will begin, or you will be given individualized follow-up recommendations by your surgeon. This Breast Cancer Surgery and Recovery podcast is intended to be a general overview of breast cancer surgery and to aid in giving you ideas about what questions you should ask your surgical team. Thank you for listening to the Plugged Into Your Health Cancer Podcast program. For more information, please talk to your surgeon or visit the Cancer Education Center for educational materials. Best wishes.